Hey, everybody. Welcome to the Green Nurse Podcast, where we bring hope and inspiration for growth and healing. We're here to change the dialogue and stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. We all deserve to feel good. You deserve to feel good. And here is what we do in the space as cannabis nurses before we dive into our show. All right.
Change the paradigm of healthcare.
The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I'm the founder of Holistic Caring. We're based here in California, and we do educational programs and case management for patients on how to use cannabis therapeutically as a medicine.
We're also here to decrease stigma around what it means to feel good and be high, hence the H for hope, I for inspiration, G for growth, and H for healing.
As the founder of Holistic Caring, I basically oversee the whole ship, and what we're doing is progressive education.
Cannabis actually supports all 11 organ systems, our immune system, and all the neurotransmitter signaling systems that give messages to tell our body to either do something or not do something. Because the plant was prohibited, it prevented health professionals, doctors and nurses from learning about cannabis as medicine.
I want to change the paradigm of healthcare and us paving the way into a new vanguard of medicine.
It's about education, it's about empowerment, it's about teaching people how to feel good, bridging the gap from what they're not getting from traditional medicine, utilizing different plant medicines, adaptogens, tips, tricks, hugs, and nugs of information to support and nourish the most important system in our body.
It's a lot of soul work, a lot of love, a lot of discipline, and meditation. I'm using my life work as a testimony to others to learn how they can be their own hero and then go help heal the world.
And we are, as nurses, the game changers. Oh, there you go. Growing in health, growing in cannabis. Hey, everyone. My name is Sherry Mack, and I'm the Vice President of Nursing and co-founder of Holistic Caring and the Green Nurse. And I'm a cannabis nurse, patient, advocate, activist, and as you all know, a very passionate podcaster here to change the paradigm of healthcare. And this show is really, really exciting for me today because we get questions all the time on cannabis, surgery, and anesthesia. And so who better to bring on the show but a nurse anesthesiologist who presented a keynote presentation at the American Cannabis Nurses Association National Conference this year on this very topic. So I'd like to welcome Dr. Danielle King. He is a board-certified registered nurse anesthetist, CRNA, owner of DreamLion Anesthesia, professor at Rosalind Franklin University of Medicine and Science in Chicago. Related to his research interests, Dr. King has disseminated several national presentations and scholarly works related to cannabis implications for patients undergoing anesthesia, with special interests also in the social stigmatization of cannabis in healthcare. His leadership roles in the field of anesthesiology include multiple prior elected and appointed positions and previous service as Chief Nurse Anesthetist for Steward Medical Group. Currently, he is chair of professional practice at the American Association of Nurse Anesthesiology, and he is a certified professional in patient safety. DreamLion Anesthesiology is Dr. King's independent anesthesia contracting business, providing full scope anesthesia services in the greater Chicago region and consulting and educational services. Daniel, welcome to the show. It is so good to see you again.
Thanks so much, Sherry. It's great to see you. It's nice to be in a themed company. with a group that is working so hard to change the narrative on cannabis in the healthcare setting. And this is something that's so important to me. I'm working really hard to also educate in the space and decrease the stigmatization that occurs in the healthcare setting.
Yeah, Daniel, it's just great work. Your presentation was just so amazing. You presented at the American Cannabis Nurses Association, Cannabis Concepts and Anesthesiology, which we are going to be presenting at Holistic Caring in the Green Nurse on September 13th at 12 p.m. at our clinical conversations. But, I was a recovery room nurse for years. And so I'm just so happy to have you come on to educate on us on what you're seeing in the operating room, preoperatively, perioperatively, postoperatively, and what is important for us as clinicians, as nurses that are guiding patients in the space, educating them. What should we be teaching, as well as what should patients be doing to maximize benefits and minimize harms? Because truly, no one wants to go under the knife. No one wants to have surgery if they don't have to. But if you're going to have surgery, you want to optimize those circumstances, right? And if you're using cannabis as medicine, you need to be able to figure out a solution if you need to replace some things. So I think this is going to be a really, really rich conversation for our viewers. And you've done so much, and I don't know how old you are. You look very, very young, but just what you've done in the space of nursing in particular is just outrageous. So your initials are very, very long. You've done a lot of different things. What led you, first of all, to become a nurse, then a nurse anesthetist, and then we'll get into cannabis. Because I always like to know what is people's nursing stories like. What made you decide to become a nurse?
Yeah, so that's a great question. I think having the lived experience really guides one's direction in the realm of empathy. And I started out very early on as a child with frequent respiratory problems, and I was frequently hospitalized. Growing up, peering out through the slits of an oxygen tent and taking breathing treatments, sometimes my parents fearing for my life as a patient on the other side of the healthcare setting. But I grew intimately familiar and curious about the healthcare setting, those things going on around me, the equipment that was being used, and definitely feeling the compassion of those taking care of me. And I really think that's what shaped and impressed upon me my desire to care for others. But I watched that lived out day in and day out by my mother, who is a nurse. And she had worked in the emergency department when I was growing up. And she has worked in cardiology for a number of years. And she is who I still aspire to be when I grow up. She is compassionate, she is caring, she is knowledgeable, she is everything that I wish to embody as a person, but also as a registered nurse. Growing up, I followed her coattails through the hospital. And these were the days before you had to file all the stacks of paperwork to go take your child to work day, right? But I was fascinated about the difference that nurses were making in the lives of others, particularly advanced practice nurses. And in a desire to be able to employ a very high level of scientific thought process and skill set, nurse anesthesiology really attracted me. Nurse anesthesiologist and nurse anesthetist, that term's used interchangeably in the field. These are providers who are highly skilled. We are experts in airway, which drew us to the front lines throughout the pandemic. We offer full scope of anesthesia services and critical care services with a strong critical care background to be able to intervene on the behalf of other patients. And you mentioned those patients are frequently arriving to us at the scariest time of their lives, potentially. And I take that as an immense privilege to be able to make a potential huge difference in their lives and safeguard them from harm. And that's driven by knowledge. So there are a lot of assumptions in the healthcare setting, but I strive for definitive knowledge. When it comes to cannabis, I observed that it seemed like I was caring for patients who were using cannabis at an increasing level. early on into my career in anesthesia. And they were frequently presenting as patients in the endoscopy suite, needing procedures, workups for things like nausea and vomiting. And I was curious because there were a lot of assumptions in terms of whether they required more anesthetic agent, on whether they were at higher risk for respiratory or cardiovascular complications. And I've since devoted my time and energy and research efforts into really kind of trying to nail that down so that we have some definitive science and knowledge to guide our practice.
Nice. That's amazing. Good work. So when did cannabis education become important to you as the nurse and anesthesiologist? When did you?
Well, when I was making those observations, taking care of patients who are using cannabis, I did what we usually do. We go look for national practice guidelines or published protocols to guide our practice. And what I found was they're really pretty lacking.
Right.
At the same time as a professor at the graduate level and teaching future nurse anesthetists, I found that there were some guidelines in play recommending education. And since 2018, the National Council on State Boards of Nursing have put forth very specific cannabis educational recommendations for pre-licensure and advanced practice nursing programs. But interestingly, we have emerging studies that demonstrate there's a persistent gap in knowledge.
There you go. Okay. Well, there you go. So, let's just cut to the chase a little bit. And then I want to get back to how we can start educating more clinicians in this space. So for patients in particular, do patients who use cannabis require more anesthesia? That's a big question for a lot of people. What do you see?
That's a great question. And what I see is anecdotally, yes, that is true. However, it's not a sum all game. So you can't say a patient uses cannabis and therefore they will require more anesthesia. It depends, okay? And that's the answer that I give my students all the time, and they don't really love that answer, but it depends. It depends on what strains of cannabis or what types of cannabis they're using, what cannabinoid products they're using, how they're using it, what the ratio of THC to CBD is in those products. And it just depends. We have some studies that are published. One of them is mine. There are a few key studies in the realm that are suggestive of this, but there's nothing definitive, and those studies are a little conflicting. We furthermore are lacking in the gold standard article, those randomized controlled trials that can really definitively guide this decision.
Right. Okay. So when you say it depends, so basically it depends upon each patient, the age, their condition, what they're treating,
Right.
their comorbidities, their medications, and the different types of other substances that they're using as to whether, so it's, you just can't say, I'm a cannabis user, so therefore you need more anesthesia.
Right. Yeah. And what I really focus in on in my practice is those who use products higher in THC.
Yeah.
Those are my concerns right now, because what we know is that THC gets metabolized primarily by enzymes in the liver. We lump these into the cytochrome P450 pathway. But the subtypes of those enzymes that metabolize THC are common pathways for metabolism and therefore theoretical mechanisms for cross-tolerance of our most popular anesthetic agent, which is propofol. Propofol shares the same common pathway of cytochrome P450, 2C9, but there are other drugs that we utilize that share other common pathways like fentanyl, Celebrex, NSAIDs, and when there's shared demand for those enzymes, upregulation or increased production of those enzymes as the body's natural adaptive response from exposure over time, that can lead to faster metabolism and therefore theoretically faster metabolism of drugs like propofol. And this is what I use to really guide conversation with patients, because they may be reluctant to share that they use cannabis, but definitively no patient wants to be awake or have a chance of being awake during their anesthetic. So that's a really great talking point, and be able to share that knowledge that we are concerned about this shared enzymatic pathway. But as I mentioned, the literature's a little suggestive at times. I explored this in a retrospective study that was published in the ANA Journal back in 2021, and I found no difference actually in patients undergoing gastroscopy in terms of anesthetic agent requirements, nor did I find difference in cardiovascular or pulmonary morbidity or mortality within 30 days, difference in satisfaction. But there have been other studies done, one in the endoscopy suite, that suggests statistically, but in my opinion, clinically insignificant difference in propofol dosing. And then there's another study from 2009 that looked at propofol dosing to facilitate laryngeal mask airway insertion. And those who used cannabis required a little more propofol, but it's so hard to differentiate. None of these studies differentiated in these studies what type of products patients were using and at what frequency.
So you didn't know what the cannabinoid was, the amount of milligrams. Was it an oil? Was it a vape? Was it a cookie? Was it a butter? Was it a top? Like whatever, you just don't know.
Correct.
So one of our viewers has a question. How about ketamine?
Yeah, how about it? Ketamine is one of my favorite adjuncts to use. Ketamine works at the NMDA receptor, so it works in a different way than our common opioid agents that we use to alleviate pain. Ketamine is also a great drug that I utilize to lessen propofol requirements while getting a similar sort of hypnotic type of effect. But there are a lot of positive effects of ketamine. I did look at this in my 2021 study in gastroscopy patients, and didn't notice any difference in ketamine requirements for those patients when it was used as an adjunct either.
Cool. Excellent. Very good. Okay. So back to risk factors for body systems. Are there risk factors for other body systems we should be concerned about for those patients that are using cannabis prior to surgery?
Yeah. So,
Airway's the big one. You figure
airway's the big one, right? So we know that the most common route people utilize cannabis tends to be through inhalation. And we know that there are some histological changes. There are some obstructive disease patterns that have some crossover between what we've seen in tobacco smoking patients and in cannabis smoking patients as well. We are concerned about some abnormalities, though, that we've observed in cannabis smoking patients, because cannabis burns at a higher temperature than tobacco does when utilized by the combustion route, a lighter to a joint, for an example. We know that vaping is at a lower temperature, but cannabis does burn at a higher temperature than tobacco. And so we have seen some individualized case reports of things like uvular edema and airway obstruction in the postoperative care unit that is really quite concerning to us as providers. It tends to be, we think it is stimulated with airway instrumentation and manipulation, and it's amenable to steroids and supportive therapy in the postoperative care unit. But yeah, pulmonary issues are one of our big concerns, as well as cardiac and gastrointestinal issues as well.
Right. Okay. So let's talk about airway, right? So people want to, they want to know, okay, how long should I abstain from inhalation prior to having surgery?
Yeah, so that's a great question. Luckily, we have some guidelines that were published by ASRA, the American Society for Regional Anesthesia, in January of this year, to provide some recommendations for us that are based on evidence. And the evidence that is suggested there is primarily not so much due to respiratory consequence, although that is a concern, and I can circle back to that, but it's from the cardiac concern. And
Really?
so the smoking route, we know, places increased myocardial oxygen demand on the patient, and definitively for that first 1 to 2 hours after that they haven't inhaled a cannabis product. We do see some odds ratios and studies with statistical reporting to be suggestive for increased myocardial ischemia risk in patients, and therefore we recommend abstaining from smoking at least within 2 hours prior to surgery. And
Oh,
so you
so
may have an elective case delayed for that reason.
okay, so you're saying hours. Okay, we were thinking people would have to stop for weeks because I've been getting I get stories from patients that come to us. My doctor said I have to stop smoking cannabis for a week. I said, well, if you want to have your surgery and your doctor's telling you need to stop smoking cannabis for a week in order for you to have your surgery to keep you alive, then you need to stop smoking cannabis, and we need to figure out another
Mm-hmm.
way for you to get
Mm-hmm.
your medicine in. So it's interesting. So because part of what I've been getting different things from different patients, from different doctors that are telling them. And so then my role as a nurse is to try to get behind the doctor's eyes and be
Mm-hmm.
able to provide the rationale for why they
Yeah. Yeah.
made that decision for them. And
Well,
so,
they're not so far off because,
airway protection, right? You
right.
want to make sure your airway is protected. You don't want, bronchospasm, right? Is a real issue. People that have sensitive airways, if you're manipulating down there, you want to minimize, right? So having your airway being protected for, 24 hours, not putting anything in there except for just regular old oxygen seems to make perfect logical sense to me.
Right. Yes, absolutely. And we do know that the longer you abstain from inhaled products, the better off you are in terms of airway reactivity.
Yeah.
And so you'll see recommendations as well for avoidance of a smoking route for 24 to 72 hours prior to surgery, but ideally for as long as possible. And then also is helpful for things like prevention of infection and improved wound healing in those patients, as well as decreased airway reactivity, of course.
Yeah. Yep. And then cardiovascular wise too, you had also mentioned about the cardiovascular system, and you said so increasing oxygen demand on the heart. That was the
Yeah. Yep, absolutely. And we see increased carboxyhemoglobin levels in these patients, as well as platelet activation as well. And this can place increased myocardial risk for these patients. But we know that, again, it depends. So like with acute use and in high doses, we do see more sympathetic nervous system activity in these patients as well. But when patients are chronic or low dose users, we see more parasympathetic activity tend to be dominant. And what we get more worried about in anesthesia during a period of surgical stress and increased myocardial demand is that tachycardia, that hypertension, those symptoms that tend to increase myocardial oxygen demand in a vulnerable period.
Okay, so I'm just going to try to make sure I get this. So we thinking about, right, so the endocannabinoid system modulates the fight or flight response and the relaxation response. So when we're putting patients under anesthesia, that could be stimulating, right, the fight or flight response.
Yes.
Could it possibly?
Absolutely. Yes.
And so what you're seeing is you're seeing patients that have cannabis on board are more apt to be in the relaxation response, in the parasympathetic. Is that
It depends. It depends if they are have used acutely or if they are chronic, a long term. Yeah, yeah, chronic. So chronic patients tend to have more chronic using patients tend to have more parasympathetic system dominant. Yes.
So they present more relaxed.
Right. Yeah.
Okay. Interesting. Okay. All right. Okay. So let's see. So for other thing for patients. So during the preoperative assessment period, right? So if someone comes in, how are you guys assessing patients for their cannabis use now? Like, hey, I'm going to go in. It's time for me to have my colonoscopy. Let's just say,
Yeah.
right? How would I be worked up for that? Like, what would that look like as far as like anesthesia? And I could tell you, I tell you honestly, like what I take. I do a tincture, I do a gummy, I do an edible, I inhale, I do it all. I use topicals, tinctures.
Mm-hmm.
And it's my medicine, and it's replaced all my pharmaceuticals.
Yeah. So this is great because this is where I spent a lot of time over the past couple of years really exploring this component. And the reason why I started exploring it is based on the study that I was mentioning to you earlier. And what I found was only 7% of those patients, only 7% of 635 patient charts that I look at, 7% of patients reported using cannabis. And I know that there was state prevalent data telling me there should be more like 20% of patients using. So there's a reluctance to disclose on the patient side, most likely. And what I have found through my stigmatization research is this is primarily due to anticipated stigma. And we quantified this in a survey that we conducted nationally. We found that patients present with a perseverating worry that their healthcare providers are going to treat them differently if they know about their cannabis use, and therefore are reluctant to disclose that they use cannabis. They also, by the way, said the best thing that can happen is we generate comfortability with the healthcare provider. And so when patients feel comfortable with us, they're more likely to have an honest conversation. There are requirements that necessitate a comprehensive anesthesia assessment prior to surgery or procedure for any patient who undergoes anesthesia. And that requires reviewing type of substances used, and including prescribed medications, but other substances as well, frequency, timing of last dose, things like that. But you see a lot of variability in practice. So you see some providers who just read the chart and count on what's in a prior history and physical. You see some providers who are hesitant to ask the question. You see some providers who ask, "Do you smoke?" Thinking that, realizing there are other ways to use cannabis besides smoking, or they'll ask, "Do you use any illicit drugs?" Maybe even in a state where cannabis is legal. So on the patient side of that, they may answer those questions accordingly, but you're not capturing an honest assessment history or an accurate assessment history. And that's really, really concerning. But our practice considerations at the American Association of Nurse Anesthesiology recommend assessing for the type of substance used, the last time it was used, any known triggers for use, a length of an abstinence period up until that event, if any, and the pattern of use. What is the dose, frequency, route, length of use, and the current level of pain and the analgesia experience for that patient.
Oh, that's good. So there's a question from one of our viewers. So how long after surgery should someone wait before consuming cannabis products?
Yeah, that's challenging. I get asked that question all the time, and we don't have any firm evidence to provide a recommendation. At this time, I can't provide you a definitive recommendation. So there's yeah, you can email our cannabis. This is where, having a cannabis expert to consult and help guide the patient through surgery would be extremely beneficial.
Yeah, it really would. We've actually worked with patients and helped them. There was a patient that I actually helped who needed to get TPN started, wasn't able to do a home start, but was a cannabis consumer, and we advocated for her to be able to use her cannabis while she was in the hospital to get the home IV TPN start. And she had a code that was, "I'm going to go out and take a breath of fresh air." And this was someone that was literally, cannabis was the glue that was keeping her together. And so they allowed her to consume while she was able to get to get on that, to get the IV going. And she had to have her IV done and the port and the whole 9 yards. So it was really, really interesting interacting with the hospital team and the anesthesia team, and how everyone was really, wanting to do the best for this patient. Because it was an unfortunate thing that she wasn't able to do the TPN start in the home. She had to be in the hospital to do it. But anyways, so we are seeing things that are progressing on this front and in a really, really amazing way. And, and we do work with, as nurses, for patients that undergo surgery, we do work with the doctors and the nurses that are on that surgical team. We're right? So as cannabis nurses, it's not, we help bridge the gap from what conventional therapy isn't providing. We provide guidance and education and help to support the healing process. And if you can't use cannabis, guess what? We have tons of tips, tricks, hugs, and nugs of things that you can do to support and nourish your endocannabinoid system in the absence of cannabis, because that's what's so beautiful about the endocannabinoid system. It can be modulated multiple different ways with or without cannabis, which I think is so fascinating. So here's another good one here. Are patients ever drug tested for THC before surgery?
Yes, not routinely, and there's actually no strong body of evidence that would support routine screening. Routine urine or serum testing for cannabis is not useful and it's not recommended. It generally only detects THC or carboxy THC, right, as metabolite. We know that. And we know that its elimination time is really, really long because it's so highly lipid soluble, it's protein bound. A positive test for THC can occur anytime after or around 30 days after its use, long after its effects have worn off. And it is not good for detecting acute intoxication, obviously. So more than that, there's no correlational data to show that a positive test result ends in poor anesthetic or surgical outcomes. So why generate the cost and time to the patient? Why create the burden in the pre-op environment? The bottom line really is that your own history and physical and your ability to have a conversation with the patient is far more important than any one test.
Yeah, excellent. Okay, here's another good one. How does cannabis use affect the surgical pain experience in your experience?
Yeah, so this is interesting, and where you'll see a bulk of the research focused on that right now is in orthopedic surgery and in trauma surgery. Um, we're concerned through this combined research that patients who use cannabis may be at risk for hyperalgesia, meaning an exaggerated pain experience after surgery. For reasons that we don't entirely understand yet, we think it's possibly the TRPV1 or TRPV1 receptor modulation that predisposes patients to that hyperalgesia, but we know quantifiably they have higher pain scores in the immediate acute postoperative pain phase of their pain experience. They require increased opioid dosing in that immediate postoperative period. Anywhere I've seen in some studies by 25% increase. I've seen studies where there's twofold increase in MME for opioid requirement. But what's interesting about that is they have lower postoperative opioid use after discharge, and they have decreased rates of opioid dependence after surgery when compared to their non-cannabis using counterparts.
Interesting. Now, what about nausea? There's a good one.
Yeah,
Right?
that's a good one too, right? Because some patients will tell me my postoperative nausea experience was worse than my pain experience, right? So that's just something that we definitely want to prevent. But patients do have increased risk of postoperative nausea and vomiting if they use cannabis. And that's really paradoxical phenomenon, right? Because we know cannabis has antiemetic properties. We're not entirely sure why patients have increased rates of postoperative nausea and vomiting when they use cannabis. But if we're able to know that in the preoperative period, it will guide our anesthetic planning more appropriately. We can utilize more of a multimodal antiemetic regimen, and we can alter our anesthetic plan so that we're minimizing the risk of nausea and vomiting after surgery for those patients.
Nice. That's amazing. Oh, you're doing such great work. So how are you working to affect positive changes related to cannabis in the field of anesthesiology?
Well,
That's
a lot of it is through
nice.
education, right? So, yeah, because we know that knowledge and stigmatization are inversely proportional. So, the more that we can increase this knowledge base in our current providers and future providers, the more that we can decrease that stigmatization component, we can have an honest, comfortable conversation with our patients. And that's going to enable us to provide informed care and make informed decisions relating to their anesthetic plan of care. We want the best possible outcomes for our patients. As nurse anesthetists, I'm proud to say we're really good at that, but we want to get as close to perfect as possible. And I truly believe that in my lifetime, we will get there. Likely with the help of partnering with cannabis experts like yourself, We may have ability in the future to administer synthetic cannabinoid receptor agonists as anesthesia providers as part of a multimodal pain regimen. I look forward to the day that that's developed and implemented into practice. But until then, we need to continue to make sure that our interventions are multimodal and that they heavily involve things like peripheral or central nerve blockade with local anesthetics, that we're preoperatively referring patients to get them on our acute pain service and make sure that they have vigilant monitoring and treatment of their pain after surgery. But education, 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 because knowledge is powerful. And again, we know this is inversely correlated with stigmatization.
Wow. Good stuff. So what else is going on for you, Dr. King, this year? What other exciting things do you have going on?
Well, I am proud to have worked on the first ever consensus developed preoperative cannabis assessment tool with one of my doctoral students. Shout out to Miss Nadia Slatke and all the work that we've been doing together, but really she's been leading on that charge. And we've worked through a modified Delphi design, develop that consensus-based assessment tool. And we want to get that out to our providers, our nurses, our perioperative folks sooner rather than later. So we're working on a manuscript to get that published, but I've taken the show on the road and have been speaking all over the country, heading to Alabama this weekend to speak to nurse anesthetists there as well. Have worked in the VA healthcare system with some great nurse anesthesiologists there to talk about it. But we've got to standardize the way that we do things, and we got to keep pushing the research forward. We're lacking in research because it is still FDA Schedule 1. And without that research basis, we have a hard time making informed decisions. So we've got to generate research, and I'm working on that primarily in the stigma and assessment domains, but really in all areas.
Yeah, good work. Good work. And we are lucky enough to have Dr. Daniel King come back to present his keynote presentation on cannabis concepts and anesthesiology. He will be presenting his keynote, his slides. Elizabeth and I will be there, fielding the audience, getting questions. And so it'll be an amazing presentation. So this has been wonderful, Daniel. I really appreciate you coming on the show. I want to do a quick little plug here. Commercial time. Today's show is brought to you by Bloom Hemp. Bloom Hemp is a women and nurse-owned national CBD and hemp supplier leading with quality, safety, value, and patient-centered care. Bloom Hemp products are USDA organic CBD grown in the mountains of Colorado and tested for purity, potency, cannabinoid, and terpene profiles. Bloom Hemp is proud to offer a free Nurse Line 970-404-HOPE to answer any questions and explain how and why CBD works in the body. So, and they're offering a promo code Green Nurse for 10% off and free shipping. And so check out the sample pack, bloomhemp.com. Remove that. And so for anyone that is new out there, new to cannabis as medicine, and you're interested in learning, we have a free network, and it's off of social media, and we would love to invite you to come there. So within the network, if you go to holisticcaring.com, you'll see a button that says network. You click on it. It's run by nurses and our pharmacist. And in there, we have an introductory to cannabis course. We have a free patient portal support. Tomorrow, we actually are doing our 4th psychedelic education integration and support group for those that are interested in learning about microdosing and that have questions about it. We're going to have Coach Michael on. Elizabeth and I will be there, as well as Nurse Denise. So we are offering a lot of free things in the network to come in, and it's also where we house all of our educational programs for patients as well as clinicians and nurses. And we are really excited that we just launched our psychedelic program, Introductory to Psychedelics, for 6 continuing education credit unions. And we bring in the endocannabinoid system and the importance of how and why we need to take care of that system if we're even going to think about using any type of serotonergic psychedelic or mushroom in our body. So anyways, we have a lot of education, and we want to offer that to you in our network. Also, if you sign up for our newsletter, we are offering a free 7-page medical cannabis guide. So if you go to the website, you just click on it, sign up for the newsletter, and it's a 7-page PDF that you can utilize and learn. And finally, if you have any questions, you can reach out and call us. We're going to answer the phone, and I might even sing a jingle. Anyways, this has been an amazing show. Thank you so much for joining us. And remember, everyone, really what it's all about. It is truly about living your best life and helping others do the same. We will see you next time. We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name and she called me and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the Green Nurses Group, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.